Today, I've got the ultimate exercise program to fix your pelvic floor dysfunction and strengthen your core for good. Pelvic floor dysfunction can affect many women, especially after childbirth or with aging. So today we're going to discuss what you need to be doing now to make sure you don't struggle with problems like incontinence or hip pain, which may potentially lead to a hip replacement later on in life. It is incredibly important to make sure that your core, including your pelvic floor, are functional and strong to help you maintain your ability to do what you want to do as you age. Now, you may be saying to yourself, oh yeah, I do a lot of abdominal exercises, so my core is nice and strong. However, are you doing anything to help your pelvic floor? You see, the abdominals work with the pelvic floor and the muscles in the lumbar spine in order to create that core triangle. And if you're only working on the front of that triangle and not working on the back or the base, something is going to end up becoming dysfunctional in the future. All three of them rely on each other to work correctly to actually perform your core exercises. So we want to make sure that we're working on all of them all the time. Now, you may have come to this video because you are already suffering with some pelvic floor dysfunction and you're looking for some exercises to do. But you may have been lucky to find this video because you're wanting to start some core exercises, and this is going to be a great video for you as well. You ready? Let's get to it. All right, so the first thing we're going to do is deep breathing with the abdominal contraction. So when you're doing that deep belly breathing, you want to be breathing in through your nose, making a big belly bubble. Then you want to be breathing out through your mouth like you're blowing out a birthday candle. And at the end, you want to do that abdominal squeeze, so getting that really good abdominal contraction. Now, when I do that squeezing, make sure you notice I'm not going to be doing a bunch of tilting while I'm doing that, because I'm just trying to squeeze those abdominals, but not really trying to move the pelvis. Some exercises we will do in the future will be more focused on moving that pelvis, but we want to make sure right now that we're keeping it nice and stable. So here's what that looks like. You're going to take a deep breath in through your nose. Belly gets bigger, and then out through your mouth. And then there's that squeeze at the end with no movement through my pelvis. In through your nose. Out through your mouth. And squeeze. You want to do that for about 10 to 15 reps to make sure that you get good control with that. Now, if you have a hard time doing it and you're getting frustrated, just step away for a little bit and come back to it another time. It can be hard to get everything else to relax because usually we use the muscles in our upper neck for that breathing, and it can be hard to get them to calm down. All right, the next thing we want to do is get those glutes really well engaged. So we're going to start by doing some glute squeezes. Now, I like to do these laying down to start with to make sure I'm really getting a good glute squeeze and I'm not using my hamstrings or something else while I'm doing it. But you can also do this in sitting and standing, as long as you're getting a good squeeze of your glutes together and you're able to hold it for 5 to 10 seconds and you're not getting all the other muscles as activated. It's really focusing on those glutes. Now, to say that you can squeeze one muscle and not get the others activated at all is basically impossible because they all work together, but we really want to emphasize that glute squeeze with this exercise. So what that looks like is you're going to squeeze your cheeks together as hard as you can. You're going to hold for 5 seconds and then you're going to relax. And you can see, even with that, I get a little shaky after 5 seconds. Now, when I do it the next time, I want you to notice I'm not squeezing and causing this huge pelvic tilt, right? When I'm squeezing, the cheeks are coming together. There is a little bit of a tilt. That's just the natural motion that happens when those glutes get activated, but I'm not trying to lift up. This is not a bridge activity. That tends to get the hamstrings more involved when you do that. Not a bad exercise, just not what we're trying to do right now. Right now, what we want to do is really just squeeze those glutes together, hold for 5 to 10 seconds, and then relax. This helps to get those glutes to become a little bit more dominant than those hamstrings, because we tend to be very hamstring dominant, especially if we have pelvic floor dysfunction. All right, the next exercise we're gonna do is actually a stretch, and it's for the psoas muscle. So your psoas is your hip flexor. Hip flexor is bringing your knee closer to your chest. But when you're stretching the psoas, it's really important to make sure that your pelvis stays in a neutral position. Now, I know that there are a lot of stretches out there that are way more aggressive for your psoas, and those may be appropriate as you progress along. However, we want to start with something that's going to be really gentle. So I'm going to have you lay either on your couch or on your bed. I've had some people like to use their living room table. Whatever works for you is fine. And you want to make sure that your foot is resting on the floor. It's really important that your foot is not hanging off of your bed, because that will actually cause the psoas muscle to contract instead of relax. So if you're doing it on your bed and maybe your bed's a little bit higher, you can use pillows or books or a stool to build the floor up to your foot. It doesn't have to be anything that you could actually stand on, so pillows would be fine. It's just something that your foot can connect with so that you don't have that contraction of the psoas. What you want to do is make sure that your psoas is in a good stretched position. Now this one's not feeling super stretchy for me. This table is actually probably a little bit lower than what I would actually do it on. That's all right, because what you can do is you can sneak that toe back, which allows that knee to drop down now further for me. And now I can feel that nice stretch through my psoas. So that's right up here. It's right in the front of the hip bone is where you want to be feeling it. Now, because I'm bending my knee more, I'm also getting some of it in my quad, which is great. Quads can definitely use a stretch too. If you feel like you still can't quite get it, the next step would be to bring this knee up to your chest and hold it in place with your hands. Now, when you do that, you're definitely going to feel more of a stretch in the front of the hip right there. And that can be really helpful when you're trying to stretch that psoas. Now this stretch I like to hold for about 10 seconds, and then I would scoot over to the other side and do the other side. Now realizing from side to side could be different. So maybe if you're on one side, you just need to have your foot on the ground, but maybe if you're on the other side, you need to walk that foot back, or maybe you even need to bring that knee to your chest. You find the appropriate level of stretch for you and hold it for 10 seconds. All right, so now we are actually going to tilt that pelvis. So the goal of this exercise is to get that pelvis moving. Now, of course, it needs to be pain-free. So you do as much motion as you can pain-free. You may be able to increase the motion over time. What you're going to do for this is you're going to contract the abdominals to tilt that pelvis up, and then you're going to gently relax the abdominals so that your pelvis tilts in the opposite direction. So when you contract, it tilts one way, and when you relax, it tilts the other way. And you might feel your sacrum, that heart-shaped bone in the center, you're kind of rocking back and forth over it. And that may feel a little strange, especially if you're on a firmer table. It shouldn't be painful, but you may be like, hey, all of a sudden I'm feeling something that I haven't noticed before. It's okay, as long as it's pain-free. So with this one, you want to do about 15 to 20 tilts. Now again, if that much motion is painful for you or causes any low back issue, just make it a smaller tilt. Do more of that abdominal contraction and relaxing. You'll get a smaller motion through your pelvis, but you can work up to that bigger motion as you feel able to. All right, we have gotten to my favorite exercise, and the exercise that I recommend all women do all day long, and definitely do them instead of Kegel exercises, and that is our deep hip internal and external rotation. To do this, you want to be laying on your back with your knees bent up, your feet hip width apart, and your knees approximately hip width apart as well. We're going to keep those knees hip width apart as we slide those toes towards each other, and then back straight forward. And we're going to keep going in this kind of windshield wiper motion. Now I have kind of long feet, so I'm actually going to move my feet a little bit further out just so I can get all the way through that range of motion. But make sure you notice that my toes are sliding. My toes are not lifting up. Lifting up will cause this to become more of a calf exercise as opposed to getting up to those deep hip internal and external rotators. After you've done 15 of those, you're going to slide your knees and your feet together. This time you're going to keep your heels together and you're going to slide your toes apart. Now you'll probably notice that I have way less motion in this direction, as most women do. I've actually only had one patient ever who had more motion in this direction. But that's all right. That's totally normal, and that's your anatomy, and that's fine. You're going to go as far as you can comfortably. You don't want to be trying to strain and causing all this other stuff to happen, right? That's not the goal. We're just trying to get that as much external rotation as your body naturally allows. And again, you're going to do 15 of those. You're going to do 2 sets of 15 once a day if you're not having pelvic floor dysfunction, and twice a day if you are having pelvic floor dysfunction. All right, there it is, your top 5 exercises to improve your pelvic floor health as well as decrease pelvic floor pain and start building core strength. Now, it's important to remember that you need to be doing these exercises every single day. It will take a while to build this strength, and you want to keep doing them until you get to the point that you're like, hey, these are really easy and I don't feel like they're challenging anymore. Once you get to that point, it's time to progress your core exercises and improve your pelvic health even further, but it's important to remember to do it every single day in order to get the outcomes you're looking for.